Valorie Butler. I am a 38-year-old mother of 2 little boys. This is my youngest son, Milo Butler. He's 10 months old.
My name is Tom Truong, and I'm an obstetrician and gynecologist here at UT Southwestern.
I'm Robin Horsager, and I am one of 3 maternal fetal medicine specialists who work out of the MFM and general OB-GYN office on the main campus here at UT Southwestern.
We came to UT Southwestern for our general OB care with our first son and continued with our second son. And I stayed with UT Southwestern because all of their comprehensive services are in the same location. So once we found out there were potential problems with this pregnancy, we never had to be referred to another location.
Valorie was a patient of one of our generalists, and around 4.5 months she had an ultrasound. It's pretty standard that most pregnant women around 18 to 20 weeks are going to have a scan where we're going to look at the anatomy of the baby. Does the baby look like it's growing appropriately? Is there normal fluid? Are the major organs developing like they should be?
With Milo, we opted to go through genetic testing just to prepare if there were any troubles. We didn't anticipate anything. We had a 3-year-old son with no problems, and so we opted for genetic testing. And at our 18-week sonogram for that, they found out that he had an unusually smaller lower jaw. So that opened up the door for multiple syndromes and problems. So we went in immediately within 20 minutes and sat down and talked to a genetic counselor, made the decision to have a amniocentesis, and within 30 to 45 minutes we were on the table to have the amniocentesis. And that was such a blessing because I didn't have to go home and stress over it. I had everything right then in the same day.
The biggest concern was that the baby's jaw, when we looked at it, and you can look at it on profile and you can look at it from the front, looked like it was a little bit small. There were some other findings as well that were a little bit non-specific. We knew that Valorie was going to be over 35 when she delivered, but her screen for Down syndrome and other chromosome abnormalities had been normal. Once we made the diagnosis of micrognathia, which is the small chin, we were concerned because that can be associated with some genetic syndromes, some chromosome abnormalities, especially when there were these other findings on ultrasound that we were concerned about. The next step was then to say, okay, what kind of additional testing do we want to do? What kind of genetic testing? So we had her see our genetic counselor. What kind of specialists are we going to involve? Are we going to have we wanted her to see the craniofacial people at Children's to talk about what would they anticipate the postnatal course being for a baby with a small jaw.
We had 1 amniocentesis, multiple ultrasounds, we had multiple MRIs, we had an in utero echocardiogram on him, so there was not a thing that could happen at delivery that we were not prepared for. And that's what we stepped into this whole thing with anticipation of potential problems, that we have all this extra time in pregnancy to plan for the delivery so there wouldn't be any surprises.
Well, I think at UT Southwestern, what's really, really nice is that within the OB-GYN practice, we've got maternal fetal medicine embedded. We are doing the ultrasounds, we are working with the genetic counselors, with the generalists on any patient that needs care. So it really is a very coordinated process. Then we add that additional element of coordinating care with the children's subspecialists as well, and that's pretty unique.
My job is just to coordinate, almost like navigate the route for our patients, especially for mom who potentially faced with a difficult pregnancy because the time of stress. And sometimes by knowing each and every one of the medical provider that she needs to see, we hope to make that transition easy.
Being a patient here at UT Southwestern, they definitely take the time with you when you come to your appointments. They definitely will stay with you to answer all your questions. Having a complicated pregnancy here with Milo, they definitely allowed me to express all my emotions and feelings and concerns and ask the same questions 5 times after they've already answered it. So they're very patient.
She was really, really concerned about how this baby was going to do. And I can remember times when she would be in tears over this. And she now feels like this baby is absolutely perfect. And that makes me feel great.
Everything's come out wonderful with Milo. He is 3 weeks now after his 3rd surgery. He was born and diagnosed with a a sequence called Pierre-Robin sequence. So we had a underdeveloped lower jaw, cleft palate. But with the prenatal care that I had here at UT Southwestern, it wasn't a surprise in the delivery room, and it's worked out beautifully. He has sailed through all the surgeries, and we're still going to be patients here for years to come.